our guests. Let's welcome our host, my co-host, AC Lucy Lengo. Good morning to you, AC Lucy.
Good morning, Immaculate Fogwe. Good morning, of course, good afternoon to our listeners and viewers out there.
How are you?
Good.
Okay, Lucy, today we'll be receiving a sexual health specialist. She's known as Marivon Agbo Ketchen. Hello, Marivon. It's a pleasure to have you on the program today.
I have the pleasure of Immaculate.
Today we are looking at something very sensitive, which is affecting, especially from my research, a lot of youths are going through this problem and they have been facing a lot of challenges. We want to know from you, who is an expert, what is chlamydia all about and what are some of the things to watch out for?
Now, chlamydia, it's a bacterial infection caused by what we call bacteria trachomatis. And so it can actually be transmitted through maybe vagina, oral, or anal sex. So we were talking about chlamydia and the symptoms. Most often people go for months or years without symptoms. Medically, we call it as being asymptomatic. But one of the symptoms you can actually look out for chlamydia, we have things like dysuria. When we talk about dysuria, we mean painful urination. You have maybe pains or discomfort while passing our urine. And also you could have things like yellowish and strong smelling vaginal discharge. You know, it becomes a problem when the color of your vaginal discharge changes. So you look out for changes in your vaginal discharge. You look out for unusual abdominal pains. You also look out for pains during sex. We call it dyspareunia. And also some men may have testicular pain. Yes, there's testicular pain. There's also a possibility of redness and tenderness in the testicles. And there's also a possibility for abdominal pains.
Now, apart from the symptoms, does it mean that someone who has, is it not normal for someone to sometimes have some vaginal discharges which are quite different from the normal one they used to have? Does it automatically mean they have chlamydia?
No. Having a change in your vaginal discharge doesn't automatically mean you have chlamydia because chlamydia cannot be detected at home. Even if you have all the symptoms, you cannot just say you have chlamydia because almost all these symptoms relate to other health issues apart from chlamydia.
Okay, now before we forge ahead, we'll give out the numbers for those who like to join us on today's edition of the program. We have 670547049. I repeat, 670547049 or 656-622-2222, And now back to you, doctor. What are some potential complications when it comes to untreated chlamydia?
Now, chlamydia, like every other infection or disease, when it's been long or left untreated or poorly treated, it comes to complications like reactive arthritis. Now, reactive arthritis is a kind of arthritis being caused by a bacterial infection, and chlamydia is a potential cause. And also, we look out to things like infertility, pelvic inflammatory diseases. Now, chlamydia causes infertility in the sense that when you have chlamydia and it's not treated or poorly treated, it helps to inflames the fallopian tubes. So when these tubes are inflamed, the fallopian tubes helps to connect the ovaries and the uterus. So the moment it's been inflamed, there is no way you can actually get pregnant. And even if you get pregnant, you are exposed to what we call ectopic pregnancy. So aside that, chlamydia might also make you to have what we call prostatitis, inflammation of the prostates. And so chlamydia can also help make you to be susceptible or vulnerable to other STIs and other STDs like HIV. Because when you have any infection like chlamydia, for instance, and it's left untreated, you're putting your white blood cells in a kind of battle form because it's stressing to fight the infection you've left untreated. And at that point, you may become immune deficient. So your immune system will lose its ability to fight against infection, and you can definitely have HIV or other infections.
Now, we are talking about a treatment. Is it possible to completely eradicate chlamydia from the system? If yes, how long does the treatment last?
Yes, it's possible to treat. Chlamydia, like every other bacterial infection, can be treated with antibiotics. So it's possible to eradicate it. And our treatment lasts from 7 days to 10 days, but it depends on your healthcare provider. Some doctors might prescribe treatment that lasts to 14 days. So, but the treatment, you could actually successfully eradicate chlamydia when you follow your proper treatment and you complete the dose. Like most people do the treatment, but they don't complete the actual prescribed dose.
Now, a lot of people complain of antibiotics resistance. Tell us about this.
Okay. I think it's one of the issues we are having in the healthcare system in Africa, Cameroon in particular. Most people will be like, this thing makes need work. It's actually working. But we have this particular antibiotic resistance cause. We consume a lot of over-the-counter drugs. That is, you buy drugs without prescription. And we fail to understand that there are different classes of antibiotics. We have broad spectrum antibiotics and we have specific antibiotics, and they have their different classes. So there's an antibiotic that can treat chlamydia. There are some that cannot treat chlamydia. So for instance, if you have maybe, let's say, vaginal itches, for instance, and you just go and buy an antibiotic, you don't even know what its function is or are, and you consume. A time might come, maybe you need it, like when you have chlamydia, you now need that particular antibiotics to help your system, and it won't work because your system had been immune to it. The drug went into your system, it did not see what to affect, what to fight, so it remained in your system. So it now give antibiotic resistance. So now if you think, or if you're experiencing antibiotic resistance, you go to the hospital. There are a couple of exams you would do, like antibiotics or antibiotic susceptible test. When they check it, they will know which particular antibiotics to give you to treat your infection and to help you with the antibiotic resistance.
With a case of a pregnant woman who is suffering with chlamydia, how can she prevent her child from being infected with this disease?
Okay, first of all, she will need to practice perfect hygiene, like 100% hygiene. The rest of the work is less for the medical personnel.
Okay.
The woman, or maybe midwife, gynecologist, or doctor, whosoever following her, will give her a couple of treatment. And even at postpartum, after delivery, they will put her on treatment. But for herself, she needs to make sure that she practices hygiene and she gets treated, because definitely treats her, not just her partner as well. Because if she's being treated, then the husband or the partner is not being treated, there'll be a reinfection that might later on affect the baby after birth.
Talking about hygiene, what are you talking about exactly?
Like bathing at least twice a day, changing the pants regularly. Most of us African women, you wear kaba, you go now go. Yes, that same pants you wore since morning to evening, night. You are just so when you do that, fluids. When they stay in a particular place for a long time, they inculcate microbes and they infect. So as a pregnant woman, you need proper hygiene. You also need to feed well to boost up your immune system to help you fight that infection, aside receiving treatment in the hospital.
Lucy, could you remind us with the numbers again, please?
Yeah, the numbers for you to join us on today's edition. We have 67054 7049. I repeat, 67054 7049 or 656 62 2222 656 62 2222 at the end. And now let's reinforce. We know that when we are talking about chlamydia, it is an infectious disease. Let's reinforce the preventive measures. We have spoken about hygiene. What are the other measures that exist for us to prevent this disease or the condition?
Now, looking at chlamydia, we'll see that for you to prevent chlamydia, aside being hygienic, you need to limit your sex partners. Because when you have multiple sex partners, you're definitely exposed or vulnerable.
We have a call on the line. We come back to that question. Hello?
Allô, bonjour.
Bonjour, monsieur.
S'il vous plaît, je souhaite rencontrer le docteur sur le plateau là. Où est-ce qu'il travaille?
On ne fait pas la publicité ici, s'il vous plaît. Si vous avez une question, vous pouvez demander et on peut appeler une prochaine fois. Okay, we lost that caller. She wanted to see you. But then we don't do publicity for that here. But there's still another possibility of seeing you maybe after the end. Call back at the end of the program to get more information about the doctor who is currently here. So, Lucy, you had a question for
Yeah,
doctor?
we were spoken about hygiene measures. Now, let's talk about other preventive measures. You were talking about your limiting partners, sexual partners. Yeah.
So, aside limiting sexual partners, you also need to use protectives. Like condom. There's no other better way to prevent like using protection. Like if you are dating, I don't know you, you don't really know me. I know you by face, but I'm not in your system to know what you have and what you don't have.
Exactly.
So it's always important to get protected, because chlamydia, like any other STI, is potential to lead to other sexually transmitted infections and even possible diseases. So it's good you use your protective measures. And also it's important to get tested. If you think you cannot be protected, you want to go raw, make sure you should get tested. Very important. And the other option, which is like slightly impossible but very possible, is abstinence.
Like you said, it's very
very impossible for sure, for some people too.
Yeah. And so now let's look at, because I really want us to talk about the preventive measures, because we know how the many people, like you said, cannot abstain from sex, and some people to find it difficult for them to go to the hospital for tests. Like you have your boyfriend, you just saw this guy, you like him, you like her, and you people just go in for sex. It is very important to stress on.
We have a call on the line. We'll come back to you, Lucy. Hello.
Hello, good morning.
Good morning, sir. Your name, where you're calling from, and your question, please.
My name is Mark. I'm calling from Bonadiri.
Okay, go ahead.
Please, I would like to know whether it's possible for a man to get chlamydia from a breastfeeding woman, because I had sex with a girl to protect myself, but I got the chlamydia from, I guess, from milk.
From milk? Okay, we'll be answering that.
I'd like to know if it's possible.
Okay. You got the question?
From milk,
Yes.
from milk meaning that he sucked the
breast.
Okay,
Yes.
Like we
it
earlier said,
possible?
it's possible. We earlier said chlamydia could be transmitted maybe through anal, oral, or vagina sex. And also it could be transmitted through getting in contact with contaminated fluids from an infected person. These fluids, it includes sperms, vaginal discharge, and if possible, even the breast milk. I think we left that out, is very important. Yes. So it's very much possible.
So if it can be contaminated through breast milk, that means even a child is susceptible to having chlamydia?
Now, if that woman is infected, like he said, that child might be susceptible too as well. So the woman needs urgent treatment.
When it comes to a child, how does it manifest?
Now, in children, as we said, chlamydia, some people go very asymptomatic. In the child, it's somehow kind of pretty difficult to easily detect.
Okay.
Yes.
And now let's look at how often sexually active people, individuals, can get tested. I was talking about the test earlier on.
Okay. If you're sexually active and you want to stay chlamydia free, or you want to know your state, normally we always say it's good to get tested at least after 3 months. But I would like to say that it's not just 3 months, because the incubation period for chlamydia is 7 to 10 days or 7 to 14 days. So you waiting for like 3 months, it might get like aggravated in your system and brings complication. So I always propose to my patients, make sure you get tested every month. It's not like HIV that will say, okay, if you do it this month, it's negative, come back for 3 months later to check. Chlamydia, you can test it every month or even after 2 months.
How much can it cost?
Now, it depends on the hospital setting. Some hospitals give it out for 5,000, some 10,000. It depends on what they are using, if they use ELISA or not. So it now depends on the hospital. There's no particular price when it comes to lab exams.
Now, when it gets chronic, how much can it cost for one to treat chlamydia?
Now, when it gets chronic, the expenditure now depends on what it has left in you. For instance, someone who has maybe just ectopic pregnancy as a result of complicated chlamydia will not have the same baseline treatment like someone suffering from infertility or like someone suffering from prostatitis. So now the expenditure or the amount depends on the complications the chlamydia have left on you. Because once you have chlamydia and it leads to complications, they don't just treat just the chlamydia, they equally treat the complications in you. So there's no particular price, but sometimes you might spend even 100, 150,000, sometimes even more.
Wow.
And you won't just do it for 7 days like you might have treated the simple chlamydia. It might take you a month or months.
Any last word for those who are watching the program and are suffering with this particular problem?
What I would like to advise our viewers and even ourselves here, including myself,
Of course.
is that there is nobody who is too strong to be infected. You know, some people have this kind of mindset. No. I guess my contributions are the broiler, you remove all sick skin. No. It's always good to be tested. And once you're tested, take treatment. We shouldn't be negligent. You know, not only one life will get to, two. So it's important to get tested and make sure you take treatment correctly. Let's avoid over-the-counter drugs. Don't just have itches and you just rush to buy maybe Doxy or any antibiotics. It's wrong. So get tested, follow due treatment, and you'll be fine.
Okay.
Our technician is just telling us that we are out of time. Lucy, any last word?
No, we are. We thank the doctor so much for honoring our invitation.
Thank you so much, Doctor, for accepting our invitation for sure.
Pleasure.
And that's what put an end to today's edition of the program. You're in the Health Ed on Equinox Radio Multimedia. For presentation, I am Immaculate Fogwe, and my co-host Asa Lucy Liengo will say thank you so much for staying with us. For technical. It was the program was technically produced by Bertrand Bonzini and Jonathan Babula. Have a lovely day in the company of more interesting programs on Equinox Radio and, of course, television. Bye-bye for now.